Hi, I'd like to talk a little bit about how we decide with the patient how big a breast implant to put in. After we've done a discussion to talk about types of implants, meaning saline or silicone, and then whether you use a round or shaped implant, the thing we need to figure out is how big they want to be. And often we start off the discussion talking about what breast bra size they are and what size they want to get to. But that really doesn't give us a great definition of how big they want to be. The tools that help us the most are pictures of breasts that the patient wants to emulate. I like patients to show me breasts that they like. I want them to show me a breast on a body on an angle so I can see how much projection the patient wants to have and how much upper pole fullness. We all want breasts to have a nice shape, which typically has a nice round bottom with a nipple in the middle, in the front. But where everybody is different is how much projection and how much upper pole fullness that patients have. And so after that, we also use a sizing kit. We have the patient put on a brassiere and then use a sizer. Here we have a sizing kit with silicone sizers. Now, this is an example of a 125 cc sizer. And we would have this go on the patient's breast underneath their bra, and they would see themselves in the mirror to see how big they wanted to be. And we would try this with various sizers. We have them going up to 650 cc's, but then we sometimes combine them. Say the patient might want to have an 800 cc implant. We would take a 150 cc implant, put a sizer, and put it right behind a 650 sizer, and that makes 800 cc's. These are not the same as breast implants, however. Notice that it has somewhat of a shape to it and even a little nipple on the sizer. Breast implants, this is an example of a silicone breast implant. They're not shaped like this. So what we put in the body is not like this. Now, there are shaped implants. Here's an example of a shaped implant, which is a little closer to these, but still they're different than the sizers. But using the combination of pictures and the sizers, we get a pretty good idea of where the patient wants to be, and usually patients are pretty happy with that result.